Spevigo is used to treat a severe form of psoriasis, generalized pustular psoriasis. Active ingredient Spesolimab. Spesolimab belongs to a class of drugs known as monoclonal antibodies. It works by blocking a certain natural protein in your body that may cause inflammation and swelling. How to use? Administer Spevigo as a single 900 mg dose by intravenous infusion over 90 minutes. If DPP flare symptoms persist, an additional intravenous 900 mg dose over 90 minutes may be administered 1 week after the initial dose. Spevigo must be diluted before use. Parenteral drug products should be inspected visually for particulate matter and discoloration prior to administration whenever solution and container permits. Spevigo is a colorless to a slightly brownish yellow, clear to a slightly opalescent solution. Discard the vial as the solution is cloudy, discolored, or contains larger or colored particulates. Contraindications. Spevigo is contraindicated in patients with severe or life-threatening hypersensitivity to Spesolimab or to any of the excipients in Spevigo. Reactions have included drug reaction with eosinophilia and systemic symptoms. Precautions. Before using Spesolimab, tell doctor or pharmacist if allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist your medical history, especially of current or recent returning infections such as tuberculosis, herpes. Side effects. Hypersensitivity and infusion-related reactions have been reported during and after treatment with Spevigo. It may cause serious side effects such as an increased risk of infection. Tell doctor if you have any signs of infection such as fever, shortness of breath, pain when urinating, fatigue, or nausea and vomiting. The most common side effects include feeling tight or weak, nausea and vomiting, headache, itching or itchy bumps, a collection of blood under the skin at the infusion site or breathing, a urinary tract infection.